Hey, this is Healthful. I'm Emma.
And I'm Jade.
So grab a tea and let's get started. Speaking of house guests.
Yes.
You've had one.
I have, yes.
Who? Tell me everything.
Spill the tea on your house guest. So I was really happy to have my sister and my brother-in-law up actually for the last few days for a long weekend. And they actually haven't been up. I don't think my brother-in-law has actually been up to visit me here ever. Oh, maybe he has. I can't remember. My sister definitely has, but now I'm questioning my memory on my brother-in-law. Anyway, so they came up since we've lived in Brisbane anyway. Yeah, for sure. So I was really lucky to be able to steal her away to record a very interesting podcast because she is a fellow health practitioner, and we wanted to talk about all the myths and things around, exercise therapy and whatever have you. So
she's an osteopath, isn't she?
She is.
Yeah.
Yes.
Yeah. Well, she will have the juicy tea.
Absolutely. So have a listen. Okay, so welcome listeners. I'm really excited to introduce our next guest. So she is an osteopath. I will also call her a hands-on, hands-off practitioner, meaning that she does obviously hands-on stuff, but largely focuses on exercise therapy or personalized kind of rehab for her patients in order to get them better with their health goals. She is the co-owner of Ascend Osteopathy, which is in Melbourne, and she also happens to be my twin sister. So welcome, Jenna.
Great, thanks Jade. Thanks for having me.
I'm really excited to have you because, look, I'm very honest, and I'll always say to my patients that rehab for me, even though I studied it at uni, it was part of our our requirements, our clinical requirements to graduate uni. I really actually dislike giving out rehab to my patients. I will often prephrase it to them and say, look, I will give you kind of bare minimum stuff, but it's not my forte, it's not my interest area, but I'm giving you this because it's still important that we give you something to work on strength-based wise. So I'm really happy to have you on to be able to clarify a couple of things here, and maybe I'll learn something from this as well with regards to clinical rehab. But first and foremost, I really want to bring up the topic, and I want you to spill the tea on core, because of course, in our profession, so osteopathy and chiro, we tend to see a lot of people with back problems, right? Mm-hmm. And the big thing that you probably will get the same, but I know for me, I'm always hearing about is I need to do more core strength. My core's really crap, it's really weak. So what would you say in order to spill the tea on core stuff?
I think it's interesting because most people do come to the conclusion, and I think it's partly social media, the internet, many years ago, core was the big focus when Pilates especially became super popular. Pilates is all about core control, core stability, blah, 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 all that sort of stuff. And that's how it kind of was marketed to the general public. And while, core is important, and it is important to have a strong core, I don't think the core is what people
should be focusing on.
Yeah, I think that there's a massive misunderstanding about what having, or what core stability or what core strength actually is.
Core even is. People don't actually, when I'm explaining core to my patients, I'll kind of give them a pre-frame, your core is not just your abdominals. It's this whole, yes, it's your abdominal wall, your fourth deepest layer of your abdominal tissue, which is your transversus abdominis, right? Mm-hmm. But then you have your pelvic floor at the bottom, you have your diaphragm over the top, you've got so many other tissues, your iliopsoas is technically part of that core structure. So what would you kind of explain to your patients if they said, oh, my core is my abs or whatnot? How would you?
Yeah, I kind of think of the core as just basically the torso. So from anything from between the shoulders to basically your pelvis and everything that those two areas encompass. Mm-hmm. So I kind of break it down into rib cage and pelvis. So you've got your two kind of sections that are connected by muscular structures, ligamentous structures, blah, blah, blah. And you kind of need the two to be able to interact with each other properly in order to manage the internal pressures of your abdomen as well as your thorax as well. Because, that people bang on about poor posture and all that sort of stuff, and it's not that you have to move in such a way where everything is neutral like it's taught in Pilates or just in general gym kind of situations. It's about knowing or understanding how to position your bony structures to then give you sufficient muscle leverage or activation or strength or, you know, whatever from that knowledge. And I think that's where people misunderstand what core strength is, because people often think, oh, it's just keeping your spine neutral and then squeezing your abdominal
abs.
muscles from there. Or some people think, oh, it's just doing a whole bunch of back extensions or, you know,
Or
ab
planks.
crunches, planks, all that sort of stuff. And you know what? The core is like any other body part. You need to train it in varied positions so that you have resilient tissues in all different directions.
Yep.
Because your spine moves into flexion, extension, rotation, side bending, and coupled movements of all those 4 movements. It's not a structured, you know, one way of movement or a rigid structure. It needs to be able to, you know, be varied in its, I guess, movement options.
And I guess as well, like, apart from movement, it's also like with regards to strength, it's like, you know, picking things up or carrying things on like one side of your body and that sort of thing as well, right?
Yeah, I think people like, you know, you've probably seen in, you know, in all workplaces, you know, when you lift heavy things, there's signs saying bend your knees, don't lift with your back, and you know, that's all good and well, but there's actually so many studies out there that actually prove that that's not actually you know,
Always the case.
the case. Like, certainly if you already have weak structures or non-resilient tissues and you do that a million times a day where you bend and lift with your back and lift heavy loads, your body is not capable of doing what is expected or what is required for that particular task. And that's where injuries can occur. So that's why, you know, building up a strong core in varied positions with varied movements and loads with progressive load is the best way to strengthen, inverted commas, your core.
Yeah.
Because, you know, you can't rely on one way of doing things. Your body moves in all different directions, so you need to have options to fall back on. Otherwise, you know,
You blow out one option.
Well, that's it. Like, you know, if you only have one option to do something, that eventually, you know, I don't want to say breaks down, but it slowly becomes overloaded because you're doing it too much.
Yep.
It's like eating the same food for the rest of your life. It gets boring after a while.
Yep.
So,
And then your body
need variety.
can't adapt. Like, if it has to eat something else, for example.
Yeah, that's right. Exactly. Because, you know, if you only ever train one way, you'll hit a roadblock eventually.
Yep. Yep.
So
yeah, that's interesting.
Yeah, that's why I get really, you know, angry when random people go up to me and say, oh, you know, I need to strengthen my core because I've got back pain. I'm like, okay, well, that's fair enough. But, you know, your core is not the only body part that you need to strengthen. You've got limbs that you know, take energy and load from the ground and transfer it up to your spine. So there's other areas that you need to look at as well, not just your core.
Yeah, so true, so true. With regards to, I guess, on the topic of strength and training your core and all those misconceptions that people are doing, can you outline a couple of the like main exercises that you think people not necessarily are doing wrong or shouldn't be doing, but the ones that aren't really that conducive to core strength, even though people think they are? We kind of briefly touched on a couple, but you know, for me, I hear a lot of, I'm trying to do more crunches. And I'm like, well, that's not really core exercise anyway, because that's more of your abdominis, rectus abdominis type exercise, I would think. Unless you're really mindful of how you switch on the rest of that musculature, that abdominal wall. I don't know. I just feel like that's not really a good core exercise. Are there other things that you can sort of mention?
I think it depends on the context. I think, like, for example, ab crunches are a great exercise because they train trunk flexion, but certainly doing a sit-up is not the only way to do that. There's many different ways that you can train spinal flexion. But I think in terms of, you know, what generally people think about strengthening the core, you know, people think, oh, I need to do more planks or sit-ups or, you know, basically spinal stability exercises where your trunk just basically kind of stays still or is held in neutral. So that's where Pilates, you know, can kind of
skew you a little bit. Like, you're missing out on if you don't vary that, like you said.
Yeah, exactly right. And I think the more options you give your body, the better, because like I said before, your body isn't a rigid structure. It doesn't move one way. It moves in all different angles. So if you can do exercises that load your tissues in varying positions, you can then give your body the best chance of injury reduction.
Yeah.
Basically, like you can't ever, remove the risk of injury or pain. That's impossible.
Yeah.
But you can reduce it by having strong and resilient tissues, and I think that's where varied positions and varied exercise really comes in. So not to shit on Pilates or shit on CrossFit or shit on any other type of exercise. They're all great in their own way, but that's where variety comes in. You should be doing, if you're a Pilates person, you should also be doing maybe a little bit of weight training as well, or even like a bit of swimming, because that involves a bit of core, inverted commas, core, exercise as well. So you just need to have way more options for movement.
Yeah. Well, that's good, because that gives our listeners a couple of ideas of other things that they could be doing for their core, and they're strengthening that process. Like in your practice, are there very specific exercises that you do give people with regards to that core stuff? Like something maybe people could potentially take home, like things that they could do at the gym safely by themselves?
For people that, actually, I probably do this with most of my patients, even if they are experienced exercises versus like novice exercises. I will often teach them the dreaded neutral spine, but not in a way that you think it is. So I actually use breath work with it, because obviously, our rib cage and our pelvis,
and your diaphragm,
diaphragm, pelvic floor, it's all connected, right? The rib cage houses our vital organs, our lungs, our heart. And if things are not coordinating properly,
with your breath,
then that means that your bony system will have to adapt to make it easier for you to, say, for example, draw air in. And that's why if you look at everybody's different spinal postures, everybody's different. They're just different strategies. There's no right or wrong posture. Someone that has a really curved back, that doesn't necessarily mean that they're in pain or they have a problem that needs to be fixed. But if they know how to move out of that position or control their bony structures, and then you can get better management of your internal pressures, which then means that you're using more efficient oxygen for exercise and for movement as well. So I actually teach, my favorite exercise to teach first up is called the 90-90 breathing drill, or the 90-90 hip lift, depending on how proficient the person is at the exercise. So basically it's kind of recruiting a bit of muscular engagement to help position the bony structures, particularly in the pelvis, to be orientated in a more neutral zone, I suppose. And then coupling that with using breath and slow breathing on top of that to get the rib cage in position. And so then that allows that nice coordination of your pelvic floor and your diaphragm to work together with the change in the bony position as well, so that you get the most efficient internal pressure management for movement. And it sort of acts as like a neutral reset, I suppose. For a lot of people, everyone has a certain way that they hold their body, which is called posture. And that's how they move around day to day. So if they don't know how to move out of that position, that then may pose as a problem to that person. So if we can teach them how to start from a more neutral zone, we'll call it, then that changes or pushes the needle to a more central position on their spectrum of movement. So rather than being all the way down one end of the spectrum, we're shifting that needle back towards the center. You can never be directly in the center. That's why I call it a neutral zone. So as long as you've got a good grasp on where that neutral zone is for you specifically, then you can unlock a lot more movement options from there, because you're more centered essentially.
Gotcha. Okay, wow, very interesting. Again, rehab's not my forte, so it's kind of interesting to hear the knowledge that you have based on all the study that you've done on rehab and movement and all that kind of stuff. So I hope listeners are getting a lot out of this one. I do have a question though, because I had a patient who, and like just kind of classic story of when someone does like a disc, or they've really, like in their lower back, I'm talking, like they do some sort of injury with their lower back at the gym. Often it's something to do with a deadlift. So I had a patient come in, one of my regulars, and she has had issues with her back before, but we've gotten her quite stable. And then just recently when she went to the gym, she actually wasn't feeling all that great with her lower back that particular day. I can't remember the word that she used, but she knew she wasn't feeling right about it.
Yeah.
And then her trainer was kind of psyching her up, like her PT was like, great, you can do this, so-and-so, just one more. And she went for the deadlift, and as soon as she came up into extension, straight away she knew something was wrong, and she was really flared up after that. So what do you think happened in that situation, or how is that something that maybe people could potentially avoid, or was maybe if your thoughts on if there was pre-existing something or other, or maybe she needs to train differently, or can she go back to doing that eventually?
Yeah, I think it's difficult to say because obviously pain in general is so individual and subjective. If you're already feeling a bit of discomfort before you do any kind of training, that's okay. That's completely normal. It's up to the individual to decide whether or not they go through with their exercise session, their deadlift, whatever they're doing. Because part of going into pain science, part of pain is obviously knowing yourself and trusting yourself. If you trust the movement, you've done it before, you know what you're doing, you're most likely going to be okay, provided that you don't try and hit a PB when you're feeling that way. Be conservative with your load management. If you are feeling a bit shit before you even start, see how you feel after you've done a bit of a warm-up. Do the movement that you're going to be doing as part of your main lift. So if you're doing deadlifts, try some, empty bar deadlift movements or other type of hip hinge type movements like Romanian deadlifts and things like that. Test that out at low loads, and hopefully that should at least warm up the tissues enough for you to then continue on to your main lift. And then if that's still not feeling quite right after that warm-up, I would, in my opinion, just keep it at that low-level load, because, again, if it's a little bit grumbly and you're trying to push more and more and more, it may just be enough to potentially irritate your back further. Maybe. It may be okay. And, again, that's knowing your own body.
Yep.
If you've got a really good trainer or you're working with a clinician and they've worked with you for a while, they should also be able to help you out and make some decisions. But at the end of the day, it's up to you.
Yeah.
Don't push things if you're feeling grumbly. And if you have a history of flare-ups doing that same movement, obviously you should be learning from those previous experiences as well. But it is difficult to answer that question without context and without knowing the individual's training history and everything like that. But just as a general rule, I would just be, warming up with lighter loads, seeing how that goes. And then obviously if that's feeling okay, you might be fine to move on to the main part of your exercise program, but at conservative loads.
Yeah.
Not trying to hit
a PB,
as you said.
Yeah. Very interesting. Well, hopefully she can go back to doing some deadlifts, because I told her from the start, obviously you've had a little bit of a boo-boo here. Don't get scared that you can't do them anymore, or think that that's it for you. Even if you hate deadlifts, it's sorry, they're a great exercise.
Yeah, absolutely.
Yeah.
Well, as a quick example, one of my patients, she's new to the gym, so she's only been going for about 4 months, had never deadlifted in her life beforehand. Did the classic first time deadlift, hurt her back, kept going to gym, kept irritating it, and I think that's that gym environment,
You get psyched up
you do
by
get
everybody
psyched
else.
up, yeah, which is awesome, but when you're injured, you don't,
Not
you
very
need,
useful.
it's not that great. And anyway, she came to see me, and we actually didn't stop her doing anything. I think that's another thing that people just immediately think that they need to completely stop everything.
Yeah.
So I actually gave her permission to still train as normal. We gave her some rehab exercises to do that was specific for her condition. Just with her training, we had to make some changes though. So we made some modifications so for her, deadlifts was the only thing that was triggering her back pain. She could do RDLs, she could do other hip hinge exercises like hip thrusts, no problems, but it was just the deadlift that she was having issues with. So we gave her permission to do everything else. We changed the deadlift to an RDL where possible, or if she absolutely had to do a deadlift, it would either be a trap bar deadlift or just a deadlift with lighter loads, like really, really light load, so that she could just focus on the movement. She obviously still had a little bit of pain as she was training, which is to be expected when you're coming back from an injury. It's okay to exercise with a little bit of pain, a little bit of discomfort, provided that it's not ridiculous.
Yes.
And fast forward like a month later, she did all her rehab, still trained at the gym, made sure that she slept and, did all the recovery, hydration, all that sort of stuff. And a month later, she's deadlifting, no pain.
That's awesome.
And it didn't necessarily interrupt her gym regime at all, really, apart from just some modifications. So it's possible to continue training through an injury, like, disc irritation, back pain. But you just need to see the right person to help you out and give you good advice, not shit advice.
Yep.
And the main thing is to keep moving, essentially, because the minute that you stop, that's where you lose conditioning.
Yeah, everything seizes up.
Yeah, exactly.
Yep.
So, I think for her, the reason why things were so successful and so quickly as well, because she was in quite a lot of pain. Like, she couldn't even bend down, put on her shoes.
Yeah.
But the good thing for her was that she was consistent with her regular movement and exercise plus her rehab as well. And she trusted her body to do it. And it paid off because a month later, now she's back to deadlifting, no problems.
And progressing too.
That's
amazing.
Yeah, so I'm really happy with her
yay.
outcome, and she's really happy too.
Yeah, well, it pays when you, like, I must say, as a practitioner, it is such a good feeling when you can help that person smash their goals. But it is, like I always say to my patients, it's a two-way street. It takes two to tango. But when you see somebody, it's so easy to kind of put all the onus on the practitioner, whoever it is that you're seeing, for them to fix you. But so my joke that I say to my patients right from the beginning, I put that down and I say, there's kind of no use if you come and say, get adjusted in a chiropractic world, you get adjusted and then you jump off a cliff tomorrow and then you come back in the next day and you say, Jade, you didn't fix me, or why is my back hurting? And it's like, well, you have to control what's around you. You have to be aware of what you're doing as well. I think that's really important.
Yeah,
so
definitely.
Having that really, like you said, that trust and having that really good practitioner-patient relationship is, I think, probably the most integral thing maybe out of anything else.
Yeah, agreed.
Absolutely. To get a change in your body. So I hate saying fix or end result or whatever, because I think it kind of goes a bit beyond that. But I think that's a really good example of where everybody knew their role and everybody fulfilled all the boxes that they needed to tick, essentially.
I mean, absolutely, because at the end of the day, how long do you see your practitioner for? You might see them, depending on what kind of practitioner you see. As an osteopath, we only see them, a patient, for half an hour once a week, maybe twice a week if they're really acute, or once every month. So we've given you the tools to help you. If you don't do the homework and just rely on your once a month treatment to get fixed, like, it's going to take you a bloody long time to get there, and it's not our body.
Not anyone's fault either. Like, it's just the way that it is.
Yeah,
I think
exactly right. But I think it's also, like, if you look at it from a practitioner perspective, you also need to set those expectations, for one, from the start, like you said, but also make sure that you don't give them that fixer mindset.
Yes.
Because it's really easy to fall into that hole. Yes. And it's really easy for patients to fall into that hole as well, because they're seeking help and you're giving them help. Of course, they want to
be better, and you're giving them a solution, but it might not always turn out the way that maybe they envisage it in their head as well.
Yeah, exactly right. So, that's probably the hardest thing to manage when you're working with a patient. But I think as long as you outline that, the onus is on the patient, you're just the coach, you are coaching them through. Yes, you might give them a bit of manual therapy just to help, but that's symptomatic relief. Remember, it's not realigning things to make their, disc magically get better or whatever it is. You're just using that window of opportunity of increased movement, decreased pain, to then quickly jump in and do your exercise or do your regular movement, so that you then again sort of reteach your body how to move.
Yep.
And how to return back to normal function.
Yeah, definitely. And what's the tea, in your opinion, on, like, just in general, the misconceptions of exercise therapy, but also exercise in general? Like, what are kind of some key things that you wish people knew about exercise and all of that?
Yeah, I think the biggest thing for people to see results, because that's what people want out of exercise generally, right? They have a goal that they want to work towards. And the biggest thing to get you there is consistency. If you don't stick to your exercise regime, whether it's 3 times per week, depending on what your goal is, you're not going to reach your goal. Or you may reach your goal, but it may just take you way longer than you ever anticipated, but you just need to be consistent with it. It's like any skill. If you don't practice it, you are not going to master that skill. So that's how I reframe exercise to my clients. It is a skill that you're trying to either improve or learn. And if you don't practice it time and time again, aka being consistent, you just won't get there.
Yeah.
You will not get there.
How do you motivate people? Because sometimes, like, maybe it's because I don't have, in my personal practice anyway, I don't have a huge focus on rehab. So I'll give them like some little things to do. But I can't be holding their hand the whole way.
Yeah.
So I find a few, not all, but a few that especially if it's not what they're used to doing, like it's a very new thing for them, that consistency drops off very quickly, or they forget. They'll, come in after a week between when I've given them something to do, and they're like, oh my God, shit, I've forgotten to do my exercise, or I've only done it like once or whatnot. Like, do you think there's ways around that?
I think if people are starting to lose motivation, it's probably more of like they can only see the end goal, not like the little goals in between. It's like, that visual of someone climbing the stairs, if you climb one step at a time, like, every 1% compounds, right?
Yep.
Whereas if you try and jump from like the bottom of the stairs to the top of the stairs, you're gonna fucking fail because it's just impossible. Whereas if you just take it one step at a time and really understand how you're gonna get from A to B, but with smaller steps, that may just help with your motivation and your consistency as well. And for some people, they just need that guidance, like, and that touch base every week or twice a week. That's why people pay trainers and, go to group fitness and go see their exercise physiologist or do their rehab session twice a week. That's that accountability. So I guess it's individual, but I think goal setting is probably the biggest thing to try and keep people motivated. And also enjoying what you're doing as well.
Yes. Definitely.
Because if you hate what you're doing, you're probably not going to stick with it. Like, how many people do you know that, start some new fad
CrossFit, I'll do CrossFit.
Exercise or even a diet, and they can stick to it for a little bit, but it just becomes really unsustainable for one, and they hate it, at the end of the day. So they're just like, I'm just going to I'm just going to be a little bit inconsistent on the weekend, and then that turns into, Friday, Saturday, Sunday, and then that turns into Thursday, Friday, Saturday, and, it just kind of compounds from there.
Yeah.
So I think consistency and goals and, shit, I've lost my train of thought. What was the thing I just talked
You got
about?
so passionate about it.
Yeah, I just completely forgot what I was talking about. And enjoyment.
Oh, of course, yeah.
Enjoyment is a big thing as
well.
well.
Oh, definitely.
So if you don't enjoy what you're doing, you are not going to stick with it.
Yeah.
Or you might just be super motivated even if you hate it, but those sorts of people are like really, really rare.
Yeah, exactly. Well, I know I'm not motivated at the gym, like the actual weight stuff, but I think that's largely because I'm somebody, I know for a fact, for the most part, I think I do better with working with somebody else or group classes. Like if I can get to the group class, I'll typically do everything that they want us to do because I'm in that environment, I'm in that zone. So I think that can be quite helpful as well.
Definitely. And I'm exactly the same. I'm hopeless on my own. If I went to a gym, like a commercial gym just by myself, I'd probably be fine for like a week. And then I just know in myself that I would just completely drop off because I hate exercising on my own. I like talking to people when I'm moving. Yeah, it's a social thing for me. So that's why I'm part of a group training gym, and it's probably not the best in terms of like goal wise for me because it's not as specific. It's not one-on-one, that sort of thing. But you know what? It doesn't matter because I'm moving and I'm being consistent with my exercise. I go 4 times a week because I like it. I like the people, and I'm actually seeing gains as well because I'm being consistent and because I'm enjoying it.
Yes.
So, practice what you preach.
Oh, 100%. Yep, exactly. And that practice what you preach, I'm just thinking, well, I hate rehab. So me personally, the times that I've had like injury and things that, I've had a period of time where I've been really consistent and then I kind of fall off the planet after that. So without that constant check-in, I'm really bad with staying on top of it.
And that's totally fine. I think that's just a human reaction. If we're too, rigid with the structure, it's ultimately going to fail as well. So it's okay to have a break every now and then, or if you need to pay someone to get you to do what you need to do, that's if you have the funds and the ability
means
to
to
do
do
that,
it, yeah, go for it,
absolutely
right?
do it. But otherwise, for some people, you just need to find that motivation somehow.
That's right. And like I think, as a lot of people would probably agree, you can't put a price on health. So
Exactly.
ultimately, if say you're not going to put that investment into, if say we're just talking about your back issue or something like that, you only have one spine. This is something that I say to patients all the time. You only have one spine. Once it starts to wear out on you, or
not do what you want it to do.
Can't put your freaking shoes on, that's really bad. Like, then that's it. Like, it's really hard to get yourself out of that hole. And how many times, you've probably had this as well, Jenna, where people say, I just wish I'd found you 20 years earlier or something. And it's like, if there's a way that we can try and help prevent that from happening, then fantastic. We're going to have a much better, much healthier group of individuals going forwards into the future.
Absolutely, and prevention is better than a cure, right?
Oh, always.
And
always,
it makes me so mad because most people will go and see their GP or their doctor if they experience back pain, particularly for the first time, and all they prescribe is medication for
that
it.
annoys me.
And there's just exercise. Well, not even exercise, just movement in general is like the most simple, free thing to advise people to, or to prescribe to people. You don't even need to be specific. Just go for a walk.
Yep.
Go for a swim.
Yep.
Something like, do some yoga, just any kind of movement.
YouTube
that would
is
solve,
free.
Absolutely. Like, that would solve so many chronic back issues, or if we're talking backs in this particular, example, but it would solve so many issues, or at least slow down the progression of that from, potentially happening.
Yeah, exactly.
It just makes me so mad that GPs can't even do that. They just reach for the drugs, all the scan, like straight away.
Yep.
People
and there's
get
no
really
other
scared.
solution otherwise. Or, for me, sorry, like to keep going on the medication bandwagon, but how often I've had patients, especially in acute pain, get prescribed like things like Lyrica, like a nerve blocking drug, or endone, or diazepam.
Really?
The muscle relaxants. I know. So that I've noticed a big trend in that. So I'm like horrified by that, because, your muscles, even though, especially with injury, they'll spasm, but they're doing it for a reason. So if you're just completely, relaxing all of those muscles, you're effectively making that problem worse, because there's nothing holding it together. And this is no disrespect to, say, massage therapists or anybody that works specifically on muscles, but trying to rub the fuck out of something is just not, I don't think, very conducive either.
I think the thing is, people have a poor understanding of what that massage is actually doing.
Yes.
They think, it's releasing a muscle, but it's not. It's creating a neurological
instability as well.
Yeah, it's just creating a neurological change in perception of tightness or pain or whatever. It's basically just emptying the cup. It's allowing you to feel a little bit better for that little period of time. And I think that's the thing that is wrong about manual therapy.
Yeah.
People have a wrong idea about what it actually does.
Yeah. Oh gosh, I could make a whole podcast on that, especially with chiropractic. Like, people just really don't understand what it's all about. So that's why I kind of wanted to create this podcast, so that we could actually dispel and spill the tea, so to speak, as all the cool kids are saying right now, on all those topics, so that this information is readily available. And look, there's always conflicting practitioners within each profession. They're not going to agree with each other, but I think the crux of the issue are these points. So if we can give that to people on this type of platform, then, or the ones that really want to seek it out as well, they're not going to be misinformed in future about manual therapies or rehab, or any of those topics.
Yeah, absolutely. And I think it starts from just spreading the word, particularly to practitioners as well, because we're the ones that people trust. The general public comes to us for help.
Yep.
If you are a dinosaur practitioner stuck back in the
the 80s,
where bed rest for everything, you're just fucking causing more of a problem, and it fucking frustrates me so much. Like, that's why I'm educating myself to more, I guess, active therapy. And don't get me wrong, manual therapy is great. Like, I still use it all the time. I use it every day when I work, but my patients know what it's doing for them. They know it's not fixing their disc or whatever. They know it's just going to provide them that, again, that small window of opportunity to feel better, so that they can do their rehab or, complete the tasks that they need to do for that particular day. And then, build up tissue tolerance and resilience from there.
That's right. And I just want to make a quick clarification there that, where Jenna and I are speaking of very different professions here. So, anything that Jenna's saying, obviously take that with a grain of salt. If you were seeing her for the type of therapy that she delivers, this is her philosophy on it. So it's not to say that, like, I practice a bit differently with my patients. A lot of my therapy is hands-on, but I'm doing it for a different reason.
Exactly. Yeah.
Yep. Cool. Awesome. Well, thank you so much for spilling the tea with us, Jena, on core, all things exercise and whatnot. I definitely learned a little bit from having a chat with you.
Oh, great.
And I'm sure that there'll be lots of questions that will come up from our listeners as well. So if we have lots of the same type of questions, people have like burning things that they want to know, I'm hoping that you'd be happy to do another podcast with us.
Yeah, totally. No, I'd be happy to do that.
Great. Well, awesome. Thank you so much for your time, and let's hope that the listeners really enjoyed today's podcast and got a lot out of it. Now, quickly before we finish, Jena, how can our listeners find out more information about, your teachings and you as a practitioner? What platforms are you on, and how do they ask those questions if they want to talk to you directly?
Yeah, I'm very active on social media, particularly Instagram. So my Instagram handle is at Dr Jena _ the Osteo effect. If you DM me or just comment on one of my posts, I will probably reply to you. The other way that you can reach me, or at least find out a little bit more information about me, is also through my Instagram. I've got a Linktree link on there. I think that's what it's called. So that will direct you to both of my workplaces. So I work at 2 clinics. One of them is mine. If you go to the Ascend Osteo website, I've got a profile up there you can have a look at. / you can also email the clinic via our email address as well.
And where's the other place that you work at?
I work at Box Hill Osteo as well. Not as active on social media with that, because obviously it's not my own business. It's just somewhere that I work. Yep. So I much prefer to advertise myself through Ascend Osteopathy and Performance, because that's where I can really shine as the practitioner that I want to be, because we have a purpose-built gym within our clinic, so I can actively work with my clients the way that I want to work with them.
Awesome. And I have personally been to this beautiful clinic before on my multiple trips back home to Melbourne. So I can say it is very, very well decked out. You've got like a squat rack, you've got
all the dumbbells,
like
everything.
Pretty well anything that you'd need for a clinical rehab clinic. I was really impressed that you had that Pilates reformer machine. That was really awesome. I love reformer Pilates, but I have not done that for a while.
Yeah, we decided to put in a reformer machine there, because it's like any other, it's not the best way to exercise or the most superior type of exercise, but we like to implement Pilates style exercises into our exercise programs, because exercise is just movement at the end of the day. It doesn't necessarily have a label to it. A movement is a movement. So however you want to do it, and if the person enjoys it, if they like to perform a hip extension movement on a reformer versus just with weights, then great.
You've got that option.
You've got the option.
Great. Awesome. Well, thank you so much again, Jena.
Thanks for having me, Jade. That was really fun.
Awesome. Oh my God. I actually never realized how similar we actually sound like on a recording. That's kind of scary.